Good morning, everyone. I'm Hayden Bush with Kaufman Hall. Welcome to today's webinar, State of the Healthcare Consumer, Measuring What Matters. Our speakers today are Kaufman Hall Managing Directors Dan Clarin and Sarah Wiley. Sarah and Dan are both leaders in Kaufman Hall's strategy practice. Dan is also the author of our annual State of the Healthcare Consumer Report. Just a few housekeeping notes before we begin. If you have any questions for the speakers, please enter them into the questions tab in the webinar interface, and we'll answer as many as possible at the end of the presentation. Also note that you can download our recent State of the Healthcare Consumer Report from the Handouts tab. And now I will turn the presentation over to Sarah to get us started.
Good morning, everyone. Welcome to our webinar. We're very excited to have you here and to have a hopefully interactive conversation. I'm looking forward to questions around healthcare consumerism. And I think, this is a topic that's been important and discussed for many, many, many years. I've been in the industry for longer than I care to admit. And I feel like we've been talking about the healthcare consumer for a really long time. So one of the questions that we wanted to talk a little bit about today is why is now different? Why is now the time to start thinking really seriously about how to engage consumers and how to think about consumers as you're building your growth strategy. We also want to talk a little bit about what that means. And in our thinking, what that really means is shifting from a patient mindset, which is sort of a traditional way of thinking about who are you serving and who are you targeting, to more of a consumer mindset. Patients are, as we'll talk about, sort of, people who walk in your front door. Consumers are all of the people that you might be able to serve in your markets and in your communities. So how do you begin to make that shift, and why is that shift important? And the third thing we wanted to talk about today was a little bit more practical, which is how do you actually start thinking about focusing on consumers, and how do you start that consumer-focused journey? We hope it'll be, as I said, kind of an interesting conversation, give you some food for thought, and we'll dive in. So why is now the time to make consumers the focus of your attention? If we start with the next slide, I think there are a few things that are really driving this transition. The first is, and this won't be a surprise to any of you in the audience, healthcare costs continue to increase. I think, when I started in healthcare, healthcare spending was about 13% of GDP, and we were terrified and horrified that it could go higher. It was unsustainable. I think now we're at 19%, and what we've seen over the past many years, past 10 to 12 years in particular, is that the share of that cost is increasingly being borne directly by the consumer. So on the far left, you'll see sort of the fact, the evidence that healthcare costs are rising faster than other costs, particularly hospital services costs. You'll also be well aware, I imagine, even if not from your own experience, that the number and the proportion of individuals who have coverage with a high deductible, so high deductible health plans, is increasing very dramatically. And in 2022, the average annual deductible for a single person was $1,562. So if you're talking about a family, you're talking more about $5,000, $6,000, which is a significant expense for most families and most individuals. It's beginning to give more and more consumers that sort of sense that first spend, that first $1,500, other than preventive care, which is generally covered, is really coming out of their pockets, and they need to make better, smarter decisions. The third thing that's really happening is that not just from a deductible perspective, but the premiums for healthcare coverage are rising relatively quickly. Just this last week, there was a study that showed that over the last sort of 30 years, I believe, the average family has lost about $125,000 in lost earnings that have been dedicated to healthcare. So as we think about our healthcare spending, so as we think about where is the consumer and what might make now different than 5 to 10 years ago, it really is the fact that more and more consumers are being asked to and are responsible for that first dollar of their coverage, or the first $1,500 of their coverage, and it is beginning to drive changes. even just personally, I've had to take my daughters in for some lab tests a couple of times. And the first time I took them to my local hospital provider, the lab was in the building. It was super easy to go to. The doctor's office is also in that same building. The cost for those labs was like $600, $700. This last time I went to a lab, local lab, independent lab, that was in my network, and I believe it cost me something like 60. So it was not something that I had actually thought that much about before until I got that first bill for what was a pretty significant amount of money. If we go to the next slide, what's the second reason that consumers, that we should start to think about kind of consumers in terms of where they're getting care and how do we begin to engage them maybe earlier in the process? I'm sure for many of us, we have the experience of walking into a CVS and seeing a minute clinic, but or to Walmart, if we live in Arkansas, Florida, Georgia, Illinois, or Texas, and being able to go to a Walmart clinic. But what we're seeing is that large consumer-oriented companies, these are all sort of have existing pharmacies, are beginning to offer very convenient, very low-cost care. So Aetna and CVS, as I mentioned, have minute clinics. They have also invested in the ability to deliver virtual care to patients or to consumers in their market. And they've also invested in that full service primary care in the form of Oak Street. Similarly, Walgreens has been building local clinics in some of their facilities. They also have a online telehealth option for individuals who need care more directly, and have also invested in VillageMD along with Summit Health, which allows them to deliver in-person primary care services. Walmart, and I think that I won't get the figure exactly right, but there's a Walmart within an hour of almost 60 or 70% of the U.S. population. Walmart is increasingly building clinics within their 4 walls. So they have, I think, around 32 now. They've announced that they'll have 75 by the end of 2024, and they're building those fairly aggressively. Those services that are available in those clinics include not just primary care and behavioral health, but also dental care, lab services, and x-ray. So they're really beginning to be that sort of front door to care for many folks. And it's not on the page, but I thought very interesting is that Costco recently announced that for its members, they've partnered with Sesame. You can get a $29 virtual care visit, a $79 mental behavioral health care visit, a $72 checkup, which includes basic labs, and then you can get discounts on other services provided by Sesame. Now, Sesame is actually was sort of established to cover self-pay people, so people that are paying cash for services. The others, Aetna, CVS, Walgreens, and Walmart, typically take insurance. But the point that we're making here is that consumers are beginning to have choices of, again, that front door to care, which from a health system perspective is really important to understand. We go to the next slide. We'll talk a little bit about Amazon, another sort of very consumer-oriented company that is making a significant play in healthcare. Again, if you think about kind of the experience that all of these organizations are trying to deliver, it's cheap, easy, convenient, and easy to access, right? Amazon, when I log on to my Amazon account, in the first tab on the upper left corner for me to click on is learn more about our Explorer Medical Care. And I can learn about Prime's partnership or discounts with One Medical. For $9 a month, I am a Prime member. For $9 a month or $99 a year, I can join One Medical, which gives me 24/7 access to chat, to video visits, and depending on where I live, but in my market, definitely, access to in-person kind of primary care visits where they've really aimed to design the primary care experience experience to be much more engaging, much more personal, and more intense, I guess, than sort of that typical 15-minute visit. At least that's what they promise. To be perfectly candid, have not tried it, so I don't know, but I do have friends who have used it and been very, very happy. I can also add my other family members for $6 a month, so up to 5 of them. So for an entire, family of 4, if I do the math pretty quickly in my head, it's about $250, maybe $300 a year for fully integrated, easily accessible care. If I'm thinking about beyond primary care, they have their $5 a month RX Pass, which offers me 50 or more generic medications, as many as I need, refilled however often my physician prescribes them or tells me I need to take them. For $5 a month, I could have 10 medications. I can have 2 medications. They promote the fact that the average savings for their members are 47% over what they would be spending based on their current insurance benefit. So pretty significant benefits, pretty easy, automatic refills, automated reminders. They offer a $35 chat visit for Amazon clinic providers, and they have a very nice link that will take me to all the things that I can buy on Amazon with my HSA or my flexible spending account. The point of talking about these organizations is that they are all looking at the health at consumers from a healthcare perspective, and they're tailoring their services to appeal to and engage those consumers. So what else has changed in our markets recently? So if we go to the next slide, what we're seeing is a lot more opportunity for consumers to actually make choices and to shop on the basis of price. So not only are they more accountable for the costs of their care, not only do they have more options and more choices for easy, convenient, accessible ways to get that care, they also are beginning, and I stress the word beginning, to have the opportunity to compare the costs of care. I'm sure many of you are aware that we have, starting in 2021, hospital transparency requirements that hospitals post in a machine readable way all of the costs of care for the care that they provide. As of third quarter of last year, about 84% of hospitals have actually done that. They aren't necessarily easy to read. They aren't necessarily easy to navigate, but they are, for the most part, being posted and beginning to give consumers a little bit of insight into some of their choices. On the health plan side, health plan transparency rules went into effect in July 2022, and health plans are required to publish the cost or the amount that they pay for covered services. And one of the things that's been very interesting, and so payers covering about 95% of the of covered lives have posted those prices. But what's really interesting, and perhaps is really kind of more of a game changer, is independent organizations are kind of developing to actually help consumers or employers, brokers and consultants and others make their way through this information to get actionable information. So just as an experiment, yesterday I logged into Turquoise Health, which is one of the organizations that provides services and the ability to sorry, my Teams is popping up for some reason. One of the services that allows me to actually compare prices in my market. So one of my daughters needed to had some unexplained hip pain, and she's an athlete, and so we took her in to get an MRI. So I thought, look, I'd be curious to see what the options are for MRIs. So I logged onto Turquoise Health. I entered the HCPCS code for the service that she received. I got self-pay prices of somewhere between $1,400 and $6,300, and then I could actually look up by insurance and by location how much the negotiated rate was. And I did just a quick gut check just to see. on what the whether or not the information was credible or reliable for my health plan. And sure enough, I didn't compare it to the dollar amount, but it was pretty accurate. And so while I think these are still niche, and I think there probably there's probably not an enormous level of awareness, these services are out there, and they are beginning to give consumers the opportunity to make actually proactive choices for non-emergent care. Healthcare Blue Book, I think I mentioned, is really focused on helping employers and brokers and agents and others. But both of these services are really geared towards helping consumers ultimately make better choices in terms of the cost and the quality. And actually, that is one of the things that's really interesting about Healthcare Blue Book is it's not actually just price information, it's actually quality information. So we go. So those are sort of the thesis. Like, why now? Consumers are more accountable for costs. They have many more choices and options, and they have a lot more ability to understand what they're actually going to end up paying for care. So how do we think? What does that mean for a health system? How do you start thinking about shifting from the patient mindset, which is? So if we go to the next slide. Actually 2 slides forward because the next one's a divider. How do we go from shifting from a patient mindset to a consumer mindset? So first, let's talk about what is a patient mindset. I sort of alluded to it already, but patients, if we think about patients, they're the people that have already walked through our front door. They are the people who have come to get a specific service. They are there for a particular reason. We may have a longitudinal relationship to them, or it may just be, they need a hip replacement, so we're going to replace their hip, or they're delivering a baby, so we're going to do that, or they've come into our emergency room and we're going to treat them and hopefully get them healthy back on their way quickly. It tends to be specialist focused. It tends to be either those emergent or maybe some of those complex kind of cases, but typically or often they are time limited. Health systems have organized around delivering care to patients, pulling together the most beautiful facilities, the best set of capabilities and services, the right set of specialists and amenities to bring folks in for those types of services. But how do we think about moving to a consumer mindset? If we think about organizing around the consumer, we're really thinking about offering really a relationship with individuals over time. So we're thinking about offering kind of comprehensive care. We're thinking about offering them care that is easily accessible, that they can navigate without a lot of difficulty to get what they need today, but also what they might need in the future. It's really focused around that kind of continuous engagement and continuous relationship. So your consumers are actively looking for care. You may have you've focused on driving the ability of consumers to access your services whenever they need, for whatever they need. And you're beginning to really think about driving a positive patient experience so that their experiences of interacting with you are pleasant and not frustrating. If we go to the next slide. I think, as we think about health systems taking on more of a consumer-oriented role, we think there are a number of benefits that can come along with that shift. So I've alluded a little bit to relationships. So building relationships with consumers leads them to spend more time with your system and your organization. It also, when you are there for people at some of their most challenging, but also potentially, depending on the circumstance, happiest moments, you drive loyalty, and that loyalty can increase the share of care that they get from your organization. You're also, when you have a consumer mindset, you really inherently have to think about the people who are the people in your community. So you have to understand what does my community need? What can I do for my community? When do they need my services, and how can they actually access them? You begin to have more of an approach that is community driven and community oriented, which really drives both, again, loyalty and relationships, but can actually also improve and help to drive that broader health of your community. You also have that, along with that, building and serving and thinking about the consumers and all of the members of your community. You actually have the opportunity to build increased trust and a better brand and reputation with your community. It allows you to think about what are the resources that you need and what are the resources that you need to be able to deploy. And so you can really focus and prioritize on those things that are most valuable and most important to your own communities in terms of where you're making investments and where you're choosing to grow service lines or capabilities and that sort of thing. And I think it increases your ability to compete with disruptors. And, I think there are plenty of stories of, disruption coming from the lower end of the market, right? The steel mills that were happy to give rebar to the mini mills, and then realized eventually those mini mills got to the point where they could deliver or they could create, really high grade industrial steel. I see that sort of parallel in healthcare. We let the Amazons, the CVSs, and the Walgreens and the Costco's really move into that primary care space. And we think, well, it's not so important for us as a health system. We have all these other really important services. But I think if you look broadly in the market, what you'll see is more and more organizations are chipping away at sort of that front door to care and moving higher and higher up that value chain and threatening more and more of what health systems have to offer. So that leads us to, what do we do about it? So let me hand it over to Dan. And Dan, you can take us away.
Thanks, Sarah, and excellent kind of tee up there for the foundation that we really need to have in place to be able to behave this way and to be able to think this way as organizations. If we go back 30 years or so as, kind of on a mass market basis, spreadsheets and computer modeling really became widespread. About as quickly as that was happening, retailers and consumer goods companies really started to be able to shift their mindset. And we talk now about Amazon and Walgreens and Walmart, CVS as being very consumer focused. And that didn't happen by accident, right? It actually happened because of the data and insights that they were able to build and have access to kind of manage and grow their businesses. And it's a transition that we need to go through in healthcare. And so if we think about it, even at the simplest level of what we measure and manage to, you look at the left-hand side here, all of the things that we've been measuring and managing to in healthcare. The number of visits, how many patients do we have, inpatient market share, all these traditional dashboard metrics that we would look at, even looking at it by department or by facility. And that's okay. We don't need to do away with that. But really to be able to do the things that Sarah has been talking about, we need to have different understanding and different insights about our consumers. And that's where we really are strongly recommending to healthcare organizations that they adopt this approach in a much more meaningful way, understanding things like how we're acquiring new patients, how good of a job are we doing at actually retaining them once we have them in the system, how well are we serving multiple needs of our patients, right? As Sarah mentioned, in terms of kind of the go-to-market positioning of healthcare organizations going forward as being, something that can serve a number of your needs and do it kind of right away in the way that you are seeking. And then not just kind of thinking about, the value or the impact of a transaction, but thinking about the actual and potential value of serving our patients over a period of time, and that when we do lose them or fail to retain them, there's a significant kind of lost value from that to the organization and to the continuity and coordination of that individual's care. And so as we go to the next page, we think a little bit more specifically about what some of these metrics mean and what they might be able to tell us, you know, they all, you know, there's kind of the potential to measure all these things in slightly different ways, and that's maybe less important. I think what's important is that in each organization, we're kind of developing a discipline and consistency around how we're defining and measuring these things for ourselves, and kind of sticking with that over time and using it to build the organizational insight. So as we think about new patients acquired, really thinking, you know, using that data that we have, those unique MRNs, to be able to understand kind of who is new relative to last year or several years ago, and then tracking that individual and seeing, are they staying with us, or are they churning, right? Are they going and getting the majority of their care somewhere else, you know, in the months or years after we've had the opportunity to serve them? And then, you know, taking a more macro look at our data and understanding how loyal are they to us, how much of their overall care are we obtaining, and what the opportunity is actually if we were to better serve them, whether through a better experience, making other services more readily available to them, getting them in more quickly. What is the upside potential if we were able to actually capture more of their needs? And then, you know, again, thinking about that over a period of time, over a period of 3, 4, or 5 years, what's the actual longitudinal value of the consumers that we're serving as we look historically in our data? And then as we think about going forward, over a period of 3 to 5 years, what could be the value that we could drive to the organization if we actually better cared for folks and we're able to keep them in the system? And this, you know, this has implications. You know, I think a lot of times we think about consumerism through the lens of fee-for-service. You know, a lot of what we're talking about here has major implications also for our ability to manage the total cost of care. And it really becomes nearly impossible to do so if you don't have these kinds of insights. And so I'd also encourage folks to, you know, to think about this not as a, you know, kind of a Me Too strategy to grow, you know, basket size like the retailers do, but actually to think about how this could be a really important element of a value-based care strategy as well. As we flip to the next page here, you know, just some examples. I mean, there are organizations that are starting to do this, and you'll see that in some of the numbers that we share around the responses that we got from healthcare system executives. You know, certainly nowhere near where it needs to be in terms of this activity being, you know, being kind of the standard and informing the decisions that we make, not just around marketing, but around kind of operations and strategies. But you know, you can see that once you start to understand these things, you can say, okay, are we actually growing? And it gets to the health of the underlying business, and actually gets to some leading indicators potentially, you know, rather than kind of having to wait for the actual volume and visit numbers. You can start to understand, okay, well, if we're actually acquiring fewer patients in a period, that's going to start to show up in a number of different ways. And if we're not doing a good job of retaining folks, kind of where are they going? What are they using us for versus what are they using other people for? And what does that say about our value proposition to the market, right? That ends up having really important implications for the overall strategy of the organization. If we can understand kind of who's choosing us, who's staying with us, and what are they using us for and going elsewhere for. Really, really important insight to be able to think about our value proposition as an organization.
Hey, Dan, if I can interrupt you, we got a question around churn rate, and I thought it might make sense to ask it now.
Yeah.
So the question is, what flags can you see in your data to show that someone has gone somewhere else? They may have moved or died. Any advice that you could share on how to execute that or how to better understand churn rate would be?
Thank you for
helpful.
flagging that.
Yeah.
Yeah, that's so a couple things. I mean, there are some macro kind of rules of thumb around how many people kind of switch insurance or move away or pass away in a given year, and certainly those can be applied. But what we've had the luxury to start to work with our partners at SG2, in thinking about deploying some of this data and thinking about how we measure and manage. And you really do, to the question, you really do need the claims data insight, right? You need to understand, for an individual, what are they doing with us? What are they doing with others? And the only way to really get at that at a detailed level is to have that kind of market level claims data and be able to see kind of where are people getting their care. And so it's not something that you can do just with your own internal kind of patient accounting data. You really do need that external view as well.
And Dan, I think, that really echoes the point you were making about the importance of having this kind of view of your customers, your patients, in terms of being able to manage value-based care contracts and arrangements. Is that share of wallet also becomes really, really important, which is also, I think, impossible to tell from your own data, right? You need consumer data, you need claims data, you need all kinds of other sources of information to really be able to get insight there. I don't know if you have any other thoughts there, but.
Oh no, I mean, I parallel it back to, my experience with Walgreens before I came to Kaufman Hall, and the retailers are not just relying on their own internal data, right, to make decisions. There's a wealth of consumer research that they're doing, but also other external data sources, right? Credit card data, a variety of different things that they're using to really put together a whole picture of the individual, and really understand not just kind of what they're doing and what they're doing with us and what they're doing with others, but why they're doing it as well, right? So that we can pinpoint those strategies.
Reminds me of a story, and I don't know if it's urban legend or not, of the woman who is like shopping in Target and gets an alert on her phone that has something to do with babies, and either she had just found out she was pregnant or she didn't even realize she was pregnant yet, but something that she had done in her consumer data suggested that perhaps she would be expecting a child soon, and Target apparently knew before either she did, or at least before many other people did. So
yeah, just the approach to data science and consumer insights is, it's hard to overstate how different it is at those organizations. I remember when I first started to get involved in the loyalty program at Kaufman Hall, or at Walgreens, and I kind of, they have a big campus at their headquarters, and I kind of went over to this other building that I had never been in before. And it was basically like an entire building of data scientists and analysts that were going through consumer data and pulling out insights to inform kind of the business and the strategies for the stores. So it's a core part of their business, as opposed to being kind of something that they just think about occasionally, right? So yeah, it's something that we really need to start to invest in and build as healthcare providers. And then I aside from kind of the underlying consumer data, as we flip to the next page, certainly and we'll talk about this a little bit at the end, but as we think about how we engage folks and kind of gather feedback from them, as they're experiencing our care and our services, certainly there's a range of ways to do that, from understanding kind of how individual transactions are transpiring and what's working and not working, all the way to a view of the overall brand and the overall affinity, for the organization. And all of these, this isn't meant to be like a scale showing one is better or worse, but it has to inform kind of your overall engagement strategy, and where during the journey you're getting insights from folks to understand what's working and not working. And just in our experience working with some organizations on this, making sure that it is kind of frictionless for people to give you that feedback and for them to be able to raise their hand when something isn't working, rather than, and we just got a couple of these in the mail actually, rather than getting the kind of the HCAPS driven mailer 5 or 6 weeks after your visit, right? Where for most people, it's just going to go straight into the recycling bin. Or you're not going to, you're only going to remember the really bad things about your visit, right? So I think this is just another element of gathering insight and engaging people in a different way, getting real-time kind of quick insights about their experiences using, kind of things on site, using text message, and just making it really easy for people to engage with you. So let's flip ahead and maybe share some of the insights from the research we did in kind of late 2023 here. This is something we've been doing for a number of years, starting back in 2016, surveying kind of both consumers and industry participants to understand, what are consumers seeking from their healthcare experiences, but also what are healthcare providers kind of doing and not doing to respond to that and to build this muscle in their organizations. And it's been just interesting to kind of observe over time. I think we're past the point where the rubber has hit the road, and now it's really a matter of kind of how far are you taking this, not really a matter of are you doing it or not. So as we think about, as we flip to the next page and start to look at some of the insights from our research, and we did a number of interviews with healthcare executives. We did a survey as well. We've got a lot, kind of a big body of direct consumer research to build on here too. You're not too late if you're not an advanced kind of consumer metric oriented organization. You're not too late. I don't want to represent kind of a false feeling of like a lack of urgency or you've got plenty of time, because you don't. But there is some opportunity still to be a leading organization in this space, at least within and among healthcare providers. Certainly not if we're comparing ourselves to other industries. We do a really good job of tracking those traditional metrics that we talked about, right? Visit volumes and inpatient market share, different revenue metrics. But as we think about really understanding the ways that consumers interact with us, and thinking about our data through a consumer lens, a lot of places actually are tracking and have been starting to think about how they get new patients, and how that kind of goes even by service or department, really lagging on share of wallet and longitudinal value. So really a lot of opportunity there. And this is very much, we'll talk about this a little bit later too. There's kind of a learn, build, and do sequence here. So you can't just jump right to kind of being an expert in this. This takes us several years to kind of learn what it is that the organization needs to be doing, then to build the infrastructure and the tools, and then to actually start deploying it. You can get quick wins along the way, but this is a journey. It's not something you're going to be able to flip the switch on. I'm noticing we have another question in the chat here, Sarah. Let's see.
Yeah, we may want to come back to them. Okay. I think that you might want to just well, maybe I'll pose this one. So one of the questions was post-pandemic, the environment seems ripe for these kinds of changes. What seems to be holding providers back to fundamentally improving the patient experience?
Mm-hmm.
I have a thought, but
Yeah, go
when you
take
start,
you start.
I
Yeah.
mean, honestly, like post-pandemic, I think cost, I mean, if we spent a lot of time at Kaufman Hall tracking the finances of healthcare organizations, and I'm sure you're all aware they haven't been great, right, over the last couple of years, particularly sort of in the once the sort of CARES money started to wind down, with a lot of health systems and hospitals, independent hospitals, kind of facing significant financial distress. So I think for a lot of organizations, including some of our clients that Dan and I have had conversations with, this is important and it's on their kind of list of things that they wanted to do or get done, but it's not necessarily rising to the top because there are sort of really mission critical kind of issues that they're having to deal with. I don't know, Dan. It's also, I think, sorry, I handed it over to Dan and I took it back. It's also, it takes time and focus and a shift in mindset. And I think education of a lot of leaders to kind of begin to adopt this approach, which I think, again, takes time and bandwidth, really.
Yeah, if you're looking at everything through a lens of like what's the immediate ROI, in some cases there may be with some of these changes, but it's kind of fundamentally a different way of doing business, and I think that's been challenging. I think the other thing that's been challenging is, and I think this is starting. I'm seeing this change a little bit with some of the organizations we work with, but I think historically there was a view that as hospital organizations, our value proposition is about quality, like the quality of the clinical care. And I think the industry has maybe been slower than would be ideal to realize that not everyone is really going to be able to have that value proposition. There are certain organizations that may be able to kind of stand on the leg of we're the best and we provide the most advanced cutting edge care with the best outcomes. But that's not a value proposition that everyone can have. And so as you then start to look to other potential ways to show up in the market, the way that you treat people and the experience that you provide is a really good option for how to differentiate in the market. And some organizations, I think, are starting to realize and recognize that and start to invest in it. But it's been a shift in the industry away from kind of a really narrow focus on clinical quality.
And I think to that point, Dan, clinical quality, there are measures of clinical quality, but I think we'd all agree that we aren't perfect at measuring it and understanding it. And so while there are amazing groups like Leapfrog and CQA and others that do drive quality improvement across the industry, for most patients, they're not necessarily aware maybe of quality ratings. Maybe they see, the Leapfrog report headlines that come out every year or what have you, but if you go back and you look at the history of sort of patient perception of quality, what you find is that it's actually the patient experience. So I don't know how old those studies are, but right, physicians who have a phenomenal bedside manner and less quality care get sued far less than physicians who have the best quality objectively for bedside management.
Yeah. So I think we've got a number of questions coming in, which is fabulous. That makes this a lot more fun. But what I'm going to do is I'm going to maybe take 3 to 5 minutes here, zip through the rest of the content, and then we'll save 10 or 15 minutes at the end here to kind of get through some of the other questions, because that's really awesome that we got questions coming in. People are engaged and want to get into it. So let's flip ahead here. This is the excuses page. Why we're not adopting this different way of doing business, and I can understand the data point. Maybe 5 or 7 years ago, actually, as we started to try to do this analysis, call it 6 or 7 years ago with some health systems, just the lack of history with electronic medical record data actually created some practical challenges about understanding the history and being able to build some models and assumptions around new patients and what good looks like, and longitudinal value and what good might look like on that as well. I think this is becoming kind of less and less of a valid reason as we go forward, and as all of these organizations invest a lot in data and technology. But you still have to have the right resources as well. So there's more investment to be done, but we should be getting to a point where we can get the data if we need it. It's just about prioritizing it. And that really gets to the second piece here, which is what I think we see more, is that we're not really sure how to kind of prioritize things here and how to get this to the top of the list. So I don't want to spend too much time on the reasons we can't do it. We'll maybe address some of that as we get into the Q&A. So I think there's a really important point here, which is a lot of our marketing colleagues, have been using data like this for a long time to inform, kind of the messages that get put out in the market. I think the real opportunity and need in healthcare is to use consumer insights and data to inform operations and strategies, and the way that we work, and the choices that we make about what we prioritize in terms of investments in resources, investments in facilities, investments in tools for consumers. That's really the opportunity, and what you see coming through in this data is that we're using consumer-centric metrics for marketing and for patient satisfaction, but we're not using it nearly as much for what services we offer, what our physical footprint looks like, how we price services, to some of Sarah's earlier comments. And that's really the need going forward. So a couple pages to wrap up here, and then we'll get to some of the questions. I think really important to think about the whole patient journey, not just the visit. And honestly, it really even goes beyond the bookends on this page. It really goes to understanding that individual's kind of entire relationship and interaction with healthcare, and where we can help solve problems for them, where we might not be today. But these, expanding from the purple to the other three is a good place to start, right? And then we'll get to the 400 level classes as we advance, kind of from just focusing on the visit to all of the other really important elements of the consumer journey. And I think really important to note here is that the blue, the orange, and the green, the search, scheduling, and post-visit, make up, in terms of the number of interactions that people have with us, those make up a lot more of the overall interaction than the actual visit. And that's often where, to Sarah's point about experience equaling quality, that's where folks are forming their views of whether the experience is good or not, in addition to the clinical care. So maybe just to wrap up, and then we've got lots of questions to get to. Where we think organizations need to go, and I think different places are at different spots along this journey to start with, but I would bring you back to that kind of learn, build, do concept, starting with, we've got to have the foundational quantitative and qualitative insights. We need to have sophisticated consumer data analytics. We need to deploy new metrics and measurement to understand the health of our business and our relationships with consumers differently. And we have to be organized and consistent in the way that we do consumer research, not just using it as a marketing tool, but using it as a way to inform our strategies and our operational decisions, and having it available for our operators and our leaders to make those decisions. And then as we build the muscle and the discipline in our organizations, having the right infrastructure to deliver experience, having some of those engagement tools that I talked about earlier to make sure that we're engaging folks along their journey, getting the right feedback and fixing things where they're broken. And then having kind of an insights discipline and an insights organization that's helping to set the agenda around what we're trying to learn as an organization in a given year, and how we're using that to inform our strategies. These first two are just building the foundation for what you need to actually be a consumer-centric organization. You can't just decide that you are. You really need to have all of this built and all of this working so that you can then begin down the journey. In the meantime, this is a general rule, and maybe there's a few organizations that are knocking it out of the park on access. What we've found is in our consumer research and in working with our clients is that starting with access is a really good place to begin this journey, and a place where you can really make an impact. And it actually tees up a lot of the changes that need to happen around the information that we need to make available to folks, the ways that we choose where we offer services, and then how we have the right kind of workflow and technology to support it. So just wanted to leave folks kind of, after all of the sharing of information, wanted to leave folks with a bit of a roadmap at a high level about what we think is the right way to start down this path, if you haven't done so in a meaningful way yet. And we can come back to these points on the summary page if necessary, but I think I'd rather get to questions at this point. I don't know, Sarah, any other comments before we do that?
No, I'm good for questions.
Great. As a reminder to everyone, please use the questions tab on the webinar interface that's to the right of your screen to ask a question. We have several teed up. The first is, how does the physician compensation model and structures compare under the newer retail-based care offerings you overviewed earlier, Amazon, Walmart, Costco, to traditional providers?
Yeah, so I'll start, Dan, and you can chime in. For the most part, so a couple of things to note. Some of these providers are using much more heavily nurse practitioners, and so their proportion of physician to non-physician staff is a little different. My understanding is that most of those are employed physicians, so they work standard hours. They have a standard set of expectations. They may, every organization compensates slightly differently, but most organizations that I know might have, some bonuses for, hitting quality metrics and quality targets and that sort of thing, but generally, I think more likely to be employed. Sesame, which is the organization that's partnering with Costco, from what I can tell, so I don't take this as like literal word, it appears that it's essentially created a platform for physicians who don't really want to deal with insurance and just get a fixed price. And so my sense is that is whether it's physicians moonlighting or physicians who really don't want to have a full-time practice and want to be able to integrate practice around their life or what have you, may be able to sign up with an organization like Sesame and actually get paid on a sort of a per piece basis, or an availability basis. So I think the models may vary some, but I do think you're much more likely to see employed versus non-employed. The other point again is a lot of these are still much more heavily focused on primary care and mental behavioral health services. So Dan, I don't know what you would add.
No, I think that's a good summary on that. It's something that I now want to go ask our physician enterprise experts at Kaufman Hall.
Absolutely.
Really.
Yeah.
Next up, we have a somewhat related question, which is, how have organizations that are good at this, have they been able to do this with an organizational structure that is aligned with the traditional healthcare model? Well, so I'm not sure you really can do it
and I don't want to assume what is meant by the traditional healthcare model here, but I guess I'll make a couple assumptions in order to answer the question. So I think you need either different leadership roles or leadership roles with different focus areas, because in order for us to be able to put the consumer at least closer to the center of what we're doing, that consumer voice needs to be in the C-suite, and so the individual who is kind of leading, consumer insights, consumer experience, consumer engagement, that entire discipline needs a real voice in the C-suite, and it needs to be to some extent a CEO priority. You also need kind of new, I don't know if department is kind of a maybe too traditional of a term, but you need new and different areas of discipline and expertise within the organization as well. Sometimes these are matrixed, so you can have in the same way that you might have HR or marketing, kind of supporting a number of different business units. You could have consumer insights and consumer analytics supporting different business units as well. And so I don't know if it's necessarily always like a fundamental change to the org structure, but you definitely need new pieces and kind of new roles and disciplines represented at the most senior level of the organization. Now, Sarah, anything else you would offer there?
Yeah, I would say you also need accountability. We all know that you get what you measure, and incentive structures within organizations matter. And so, if Dan mentioned it has to be a priority at the CEO level or at the very top level, but you also, if you really want to move it, you have to create accountability for the organization for achieving certain targets and results. And those can't just be at the CEO level; they actually have to be cascaded through the organization to department heads and to others, depending again on what your metrics are. And satisfaction and engagement metrics can be kind of linked and so forth. But I think you really do need to create accountability. Without accountability, it won't happen. And frankly, you have to change mindsets, particularly when you get to things around access and scheduling. We've done consumer surveys and consumer focus groups, and consumers really want to be able to self-schedule. Physicians, for the most part, really don't like their patients to be able to self-schedule. But beginning to put sort of that patient experience first and saying, I know you don't want them to do this, but like, can we do it on the afternoons, or looking for ways to sort of change some of the orthodoxies we have around how care is delivered, when care is delivered, and by whom is really important, because we have designed our healthcare system to really work for our providers. We have not designed it to work for consumers and patients. And that is a fundamental mind shift that's going to require some changes to the mindsets and the habits that we have within our organizations.
Great. We have time for one more question. There's a question about, I am assuming that the type of consumer metrics need good access to insurance claims. There's a question about, how you identify a vendor for that. There's also a question about how you identify an EMR vendor to help you with your data insights.
Yeah, and I'm gonna turn off my video just because I think my connection is not the best right now. Maybe I'll check quickly. Sarah, can you hear me?
I can.
Okay, good. So, yeah, certainly don't want to turn this into a commercial for any, given vendor or EMR. But I mentioned what I've had experience with, and what I've been fortunate to have experience with, is just working with our partners at SG2, who have been really thoughtful about building the data infrastructure to be able to analyze some of these consumer metrics. So that's really the only one I can speak to at this point. I haven't kind of gone out and played the field with this. I know there's not many though, because the kind of the level and depth of claims data you need to do this in the right way, there's only a few places that have really built that. On the EMR, I don't know. I mean, I don't know that there's a big correlation between having Epic or Cerner and kind of how consumer oriented an organization is. I don't really, I'm not sure that that's kind of the driving factor.
Great. Well, I just want to thank Sarah and Dan again for their presentation. As a reminder, you can download the report right now in the webinar interface. You will also receive a link to a recording of the session. We've got several questions about the presentation. We'll be emailing you that as well. Hope everyone has a great day, and thanks for joining us today.
Thanks all.
Thanks very much.